Head-to-toe physical assessment with neurological assessment. The patient's name is Askala and is here for a physical assessment. Her nurse is Courtney Elliott.
Come on in.
Hey, how are you?
Good, how are you?
My name is Courtney. I'm going to be your nurse today.
Okay.
Miss Askala, can you tell me your name and birthday?
My name is Askalemariam and my birthday is December 1977.
Okay. Do you know where you're at today?
Yes, I'm in a GTCC hospital.
Okay, and what's the date?
Today is September 11th,
Okay, and what year?
2013.
Okay, that's good. I'm going to give you a set of numbers to remember. At the end, I'm going to ask you those numbers again. So 9, 8, and 7.
Okay.
Okay.
Courtney is now going to take a set of vital signs.
I'm going to take your vital signs, okay? And if any time you have any pain during the assessment or anything I do causes pain, please let me know. Are you having any pain right now?
No, I don't. I took my pain medicine.
Okay, that's good. I'm going to, can you lay down for me? I'm going to raise your bed up. Okay. I'm going to take your blood pressure. And just leave your arm relaxed on the bed. Okay, it's 120 over 76. Is that normal for you?
Yes, sir.
I'm going to take your pulse ox. Put this on your finger. Okay, you're at 100% this morning.
Okay.
I'm going to take your temperature. Okay, stick this under your tongue. Okay, 98.6. Okay, I'm going to take your pulse. Pulse is 62. Is that normal for you?
Yes.
Courtney will now watch her respirations. While assessing if she's using any accessory muscles or having any difficulties.
Okay, your respirations are 18 and your breathing is even and unlabored. Are you having any problems breathing?
No, I'm okay.
Okay.
Nurse Elliott will now check the patient's gait.
I'm going to lower your head. shoes on. I'm going to see you walk. Okay, you can walk this way for me. Okay, turn around. Good. You feeling any dizziness or lightheaded?
No, I'm okay.
Patient gait is normal.
Patient is relaxed, has erect posture, and coordinated movements. Nurse Elliott will now start the head-to-toe assessment. Starting with the head, Nurse Elliott will be feeling for any abnormalities, looking for lesions, lice, and to be sure the hair is evenly distributed.
No wounds or lacerations or any lice. It's evenly distributed. You have any pain in your head this morning?
No.
Okay. Okay, I'm going to check your face. Your face is symmetrical. Your eyebrows are equal. I'm going to check your sclera. Those are white and equal. And conjunctiva is normal. Okay. I'm going to check your nose. Okay. No drainage.
Face is symmetrical, eyes are evenly set and free of drainage. Next, Nurse Elliott is checking for perla.
I'm going to shine this light in your eyes, okay?
Checking for consensual.
Okay.
Now, Nurse Elliott will check for accommodation.
Following my pen light. Pupils are also round and reactive to light, and accommodation is normal.
Now, Nurse Elliott will check optic nerve 3, 4, and 6, oculomotor, trochlear, and abducens, the 6 cardinal gaze of field.
Okay, I want you to keep your head still and follow with your eyes my pen light. Very good.
Optic nerve 3, 4, and 6 are intact. Next, cranial nerve 2, optic with Snellen chart.
Okay, I'm going to have you put your shoes on and walk to the Snellen chart. I'm going to check your eyesight. Okay, just stand right there, cover one eye, your left eye, and read line 8 for me.
DEFPOTEC.
Next eye.
DEFPOTEC.
That's good.
Checking cranial nerve 1, olfactory.
Okay, can you close your eyes for me? I'm going to have something for you to smell, and you tell me what you smell. Okay.
It's like garlic.
Yes. Yes, it is. Okay. I'm going to check your mouth now.
Courtney is now checking for any cavities, fillings, partials, dentures.
Okay. No wounds or lacerations in your mouth. And you don't wear dentures, do you?
No, I don't.
Okay.
Next, she'll be checking cranial nerves 9, 10, and 12, glossopharyngeal, vagus, and hypoglossal.
Okay. Can you stick your tongue out for me? Can you move it around? Good. Can you say ah?
Ah.
Uvula is midline, and she's able to move her tongue. And there's no ulcers in her mouth.
Mucous membranes are pink and moist.
I'm going to check your sinuses. You have any pain?
No.
Okay. Sinuses are normal.
Next, checking cranial nerve 5 and 7, trigeminal and facial.
Okay. I'm going to have you close your eyes, and whenever you feel the cotton ball, you say where you feel it at. Okay?
forehead, chin.
That's good. Okay, I want to have you puff out your cheeks for me. Okay, smile. Scrunch up your face. Good.
Next, checking cranial nerve 8, vestibular cochlear.
Okay, I'm going to check your ears. I'm going to pull up and back. There's no drainage. Also checking for infection in your earrings or behind your ears. That's good. And I'm also going to, have you close your eyes for me. Whenever you hear me snap, tell me which ear you hear it in.
Right. Left.
Correct?
Cranial nerve 8 is intact. Next, Nurse Elliott will check cranial nerve 11, accessory.
Okay, I'm going to have you shrug your shoulders for me. Good. Okay, can you push up on?
Cranial nerve 11 is intact. Nurse Elliott will now check carotid pulse one at a time.
Pulses bounding and equal.
Next, Nurse Elliott will auscultate posterior lungs while inspecting the skin.
I'm going to listen to your lung sounds. Every time you hear or feel my stethoscope, I want you to take a big, nice, deep breath for me, okay?
Lungs are clear, equal, bilateral. Nurse Elliott will now check interior lung sounds.
Okay, same thing. I want you to take a deep breath whenever you feel my stethoscope, okay? Okay, lungs are equal and clear in all lobes.
Next, Nurse Elliott will listen to the patient's heart.
The aortic. Pulmonic. Herb's point. Tricuspid. And at the mitral valve, I'll listen for 1 full minute for apical pulse. Okay, apical pulse times normal.
Now Nurse Elliott will be checking brachial and radial pulse.
Check your pulses. Okay. Pulses are equal and bounding.
Next, she'll be checking for skin turgor and capillary refill. No tenting and capillary refills within 3 seconds, less than 3 seconds. Courtney will now check range of motion, active and passive.
And you hold your arms up, out, and forward for me. Good job. Okay, I want you to push against my hands. Okay, and this time don't let me push. Good. Okay, can you grip my hands? Very good. Range of motion is normal and strong.
Nurse will now inspect abdominal area.
Okay, I'm going to have you lay back for me. When was your last bowel movement?
This morning.
And was a color normal and consistency normal?
Yes.
Okay, and did you also void this morning?
Yes.
Okay. Was yellow color?
Yes, it was.
Okay. Abdomen is non-distended. I'm going to now listen into all 4 quadrants, starting in the right lower quadrant. Bowel sounds are present in all 4 quadrants.
If Nurse Elliott did not hear bowel sounds, she would listen to each quadrant for a full minute. Next, she will be feeling for
I'm going to palpate your abdomen, softening. You have feeling any pain?
No.
Okay. Now, moving on to the pulses. I'm going to check your femoral pulse. Popliteal pulses. Posttibial. And your pedal pulses. And they're all equal and bounding. I'm also going to check your capillary refill and your toes. And they're less than 3 seconds. Also, I'm going to inspect your heels. No ulcers.
also checking for any bruising, petechiae, or edema.
There's no edema present. Okay, range of motion.
On the lower extremities.
Can you pull your legs up for me? Good. I want you to push against my hands. Okay, pull. Range of motion is good and normal.
Now ask the patient to roll on the side to check her backside, looking for ulcerations, red spots on skin, and hemorrhoids.
I'm going to have you roll on this side. Grab this rail for me. I'm going to check your back. There's no ulcerations, wounds, or redness present. Also, I'm going to check for hemorrhoids. There's also no redness or bleeding. No hemorrhoids. Okay, want you to lay back for me?
This concludes the physical assessment, and the nurse will document all
Can
findings.
you remember those numbers that I told you?
Yes.
Okay, what were they?
987.
Okay, that's correct. I'm going to lower your head. Okay. You have your call light.
Do you think the doctor will discharge me today?
We'll have to talk to him and see, and I'm going to document and wash my hands. I'm gonna close the door. If you need anything, hit the call light, okay?
Okay, thank you.